Hello guys. This is my first ever oh my god. This is my first ever time doing a YouTube stream, so here it is. Yeah. I'm a doctor. I got this. How many patients have I had? 20? It's not that bad. Kyle Walker. Sir, if I take care of you, will you promise not to die on me? Nod if yes. Okay. Oh! Okay, I think that means yes. Please don't. Listen, like, I don't know, like, so far I have, like, 2 patients already, and they died on me. That were severe, by the way. Severe. Excuse me. So, hopefully this guy doesn't die on me. Don't die, bro. Okay. Hurry, hurry, hurry. Can we get patient room 6? I should have checked that before. Oh, you suck. Okay. Linens, and then your gown, and then... Oh, no! Oh, crap! Wait! Oh my god! Wait! Okay, wait, you need a blood? Wait, Tylenol? Okay, Tylenol? Okay, where's the Tylenol? Okay. Oh my god, please do not die on me. Holy shit. Do not die on me. Okay. Okay. Lights. He wants an ice pack. Okay. Sir, please do not die on me. Oh my god. Yeah, he's dead. Okay, so stop closing the freaking door. Okay, so he wants saline and 2 blood. Okay. Sir. Oh my god, blood. And then, oh shit. Oh, fuck. Oh my god, I'm so sorry. Okay, what do you need? I'm so sorry, sir. Okay, you want juice? Okay. Oh my god, I hate this. Okay, let me diagnose him. Okay, anemia. Anemia, chills. Okay, anemia, chills. He has like a 4th thing. Dehydration. Anemia, chills. Anemia, chills, dehydration. Okay, here's this thing. Okay, let me restock this. Let me restock it with blood. And then I will get saline for you. I have saline in my hand already. Oh my god, I hate this stupid thing. Okay. What did I diagnose you with? Hypovolemic shock. Okay. Oh my god, can this thing hurry up? Please do not die on me, bro. Okay, this is saline. I have to sneeze. I don't have to sneeze. Okay, he's alive. He's alive. He's alive. He's alive. Thank God. Okay. Okay. Sir, I'm admitting you to the hospital. You can be on your way. It says rushed for the ICU for aggressive IV, what? Yeah, and blood transfusions. The patient's blood volume was restored and organs stabilized. After intensive monitoring, they were discharged and recovered fully. Okay, awesome. Let's get a gown. Let's get a linen. And then, you know what? You go you, that dude. Okay, gloves removed, and then let me get new gloves. Okay, what patient are we getting next? Let me get Danielle. Oh, no, I don't. Oh my god, whatever. Why did you have to be severe? Why did you have to be severe? Okay, let's get you over there quickly. Okay, 7. What's up with you? Chest pain. You need oxygen. Okay, blood, Drylex. You want a beta blocker and Drylex. Okay, beta blocker and Drylex. Submit that there. And then you also want a blood IB. So let's do that for you, sir. He looks like Victor from Arcane. Okay. I don't know why this thing is always so... Okay. He needs water in a blanket. Those are... Yuck. Ugh, I disturbed that. Blood. Let's get you a water. Water's over here. Then we can get the blanket, and then we can go back to... So, water. Blankets. We got this, we got this, we got this. And then we have to diagnose him. Here's your blanket. You must be super cold. Water. Let's see. So, chest pain, shortness of breath. Chest pain, shortness of breath. He has this thing. Chest pain, shortness of breath. Do you have a cough? You do have a cough. So, you got pulmonary embolism. Yeah. Let me discharge you. Went to the hospital. You need to be on your rush to the ICU for blood thinners and oxygen support. The clot was dissolved and the patient's breathing stabilized after discharging with what? Anticoagulation therapy. They avoided future. I saved a man. Awesome. Okay. You actually saved 2 people with them having similar causes, so that's a good part on me. Hold on, I gotta make sure if my audio is loud enough, cause yeah, last time it wasn't, and I was super quiet. Oh wait, hold on, let me lower this down, just in case. Okay, who will be my next patient? I forgot to change my gloves. Oopsies. I mean, technically I don't have to. Listen, for sanitary, that would be better for sanitary reasons. Who is next? I was gonna get you. Let's go. Let's go, Danielle. You're going to room 7. You get the linen sheets, and then I'll give you your gown. Let's see what's up with you. So, you want an ice packing sandwich, but you have chills. Oh my god. Okay, so Tynadol, 2 Tynadols, Inflamix, and a Zoid. Okay, two Tynadols, Inflamix, and a Zoinex. I will give you your saline. Here you go. What is this Tylenol? Okay, you will get your saline. Then what do you want? You want a sandwich, and then an ice pack is right here. I got you, girl. Okay, sandwich, and then a saline, and then you'll be discharged. Wait, no, I haven't diagnosed you yet. I'm so sorry. Wait, chills, dehydration. So, cross that off. They don't have chills. Chills, dehydration, vomiting, fever, inflammation. You have gastro and yeah. I will. Are you ready to be discharged? Yes, you are. Okay. Admit to the hospital, and then admitted for IV fluids and anti-nausea medication. Get out of my room. Medication. The patient's dehydration was reversed. Symptoms resolved after discharge. They fully recovered with a bland diet. Okay. Let me get a gown. And then, what is this? A linen. Okay. Who is my next patient? You know what? Whatever. It don't matter. Maybe if they die, it does matter, but yeah. let me get you, Franklin. I guess that big buff dude is the janitor. He's kind of scary. Okay, let's do the linens, your gown, and then what is up with you? So you want a sandwich? Okay, the lights to be turned off. I got you. Okay, chest pain. Okay, you do need oxygen. Tylenol, beta blocker, and Drylex. Tylenol, beta. Okay, Tylenol, beta blocker. Okay. Then here you go, sir. Then your needs: you are hungry and you're thirsty. Get you your sandwich first. Oh lord, let me get out. Okay. Close the door for you. What was that? Oh. His symptoms are chest pain, shortness of breath, fever, and a cough. Let's see, chest pain. No, he doesn't have dehydration. So chest pain, shortness of breath. No airway. Chest pain, shortness of breath. Does he have a fever? Yeah. Chest pain, shortness of breath, fever, and cough. Chest pain, shortness of breath, fever, and cough. You have acute bronchitis. Okay, I can discharge you now, admit you to the hospital, and you can be on your way. Admitted for breathing treatments and supportive care. The patient's cough improved. What? Improved and breathing eased. After discharge, they recovered fully with rest and medication. Okay. Why am I stuck in this door? Oh my god. Let's grab the gown and then the linen and... Well, he didn't die, so we don't have to change them. Who is next? Let's do you. I like this guy. Okay, let's do the linen. Get in your gown, and then what is up with you? Okay, you want the lights to be down. Oops. You want an ice pack and a blanket? Do I have to? No. Okay, so medicine would be Zofanax and Drylex. Zofanax, Drylex, and Zofanax. Then I would give you burn ointment, and then a blood IV. Can you leave my patient alone? Okay, so blood, and then you would also want burn ointment. Then this, I would administer the blood. Okay, I don't know why your thing is high. You want an ice pack and a blanket. Can I get this? Okay. Blanket is over here, and then I will, let's see. Thermal injury, anemia. Wait, hold on. There you go. Wait, okay. So, thermal injury, anemia, vomit, cough. Thermal injury, anemia, vomiting. Wait, what? Thermal injury. What? Yeah. Anemia, cough, and vomiting. So you have a burn. Do you have a fever? No. Okay, I diagnosed you and you can be discharged to the hospital. Admitted, for proper wound care and pain management. The burn was cleansed, dressed, and monitored for infection. After discharge, the patient healed well, leaving only minor scarring. Okay. We'll get the gown and then this. Oh, did I get it? Nope. Who's my next patient? I don't know why they don't, like... Whatever. Wait, have you been here for a while? I get you. Yeah, I'm just gonna take room 7. Then you can get in here. Then what's going on? So, okay, oxygen. Tylenol. Okay. Tylenol, beta blocker, and Drylex. Tylenol, beta blocker, Drylex. Okay, and then what do you want? You want... Okay. Give this to you. Here you go. Do the lights. Drylex. Then an ice pack for you. I will give you a sandwich. And then... Well, actually, I need that open. Why did I close that? Okay. Did I get a sandwich? Guys, you saw that. I grabbed a sandwich. Maybe I misclicked it. Or I ate it? Okay. Okay, so chest pain, shortness of breath, fever. Chest pain. Okay, shortness of breath. Chest pain, shortness of breath, fever. Does she have airway? No. And she has a cough. Chest pain, shortness of breath, fever, cough. You have acute bronchitis. She doesn't have dehydration and she doesn't have this. So I can discharge you, admit you to the hospital, and then submit. Okay. Admitted for breathing, treatments and supportive care. The patient's cough improved and breathing eased after discharge. They recovered fully with rest and medication. Awesome. Hold on, I'm just making sure my thing is still that I'm heard. Okay. Who is next? You have been here for a while. I will save you. Oh, this is a bad time to lag. Super bad time. Okay. Get you in. Okay, so you need oxygen. Beta blocker and Zofinax. So beta blocker and Zofinax. Beta blocker and Zofinax. And then what else do you need? You need a sandwich and juice. I'll give you your medicine first. Okay. So you want a sandwich and then you want juice. Can you move out of my way? And then your sandwich. And your symptoms: chest pain, shortness of breath, vomiting. Chest pain, shortness of breath. Wait, what? Okay. Chest pain, shortness of breath. Oh, heart attack. I will discharge you, admit you to the hospital, and then rush to the cardiac unit. The patient received clot busting medication and the stent placement after discharge and cardiac rehabilitation. They made a strong recovery. Good. I'm happy that guy is alive. Who is my next patient? Who has been here for a while? I think this dude. Come with me. I didn't even see if his thing was like severe. It's probably moderate. If it's severe, then I am so sorry. Yeah, I was right. It was moderate. Okay, what is... Do you need oxygen? No, you just need saline and Tylenol. So, Tylenol. And then the saline bag. And then you want an ice pack and milk. So, there. I will give you an ice pack. And then your milk. And then I will give you your saline. Saline. You want milk. then saline. Hello? You are thirsty. Here's your milk. And then your saline. And then I will discharge you. You'll be good to go. Did I diagnose you? Oh, nope. Dehydration fever. You just have severe dehydration. You know, you should have had water instead of milk. But to each his own, I guess. Admitted for IV fluid replacement. Yeah, the patient's electrolytes and were balanced and vital signs stabilized after discharge. They recovered fully with oral hydration. Yeah, because he needed the milk. Ooh, I think you've been here for a while. Come on. What is up with you, Jonathan? Whoa. Okay, do you need oxygen? You do. You need beta blocker, Tylenol, and Roblax. Beta blocker, Tylenol, Roblax. Then after that, you will get saline. Here's your medicine. Oh, oops, I will give you the saline. Let me close the door for you. Saline, you want juice? Wait, hold on. Wait. Yeah, juice. I'll give you saline. Saline, you want juice? I'll be right with you with your water and blanket. Okay. Water, and then his blankets. Where's that buff guy cleaning around the place? Here is your blanket, that, and then what is your diagnosis? Fever, chest pain, shortness of breath. Fever, wait, chest pain, shortness of breath. You also have dehydration and cough. Fever. What? No. Fever, chest pain. What? Shortness of breath, cough. Dehydration. What? Oh, fever, cough. Hold on. Fever, cough, shortness of breath, dehydration, and chest pain. Okay, so you do have pneumonia. Admitted for IV biotics and respiratory support. The patient's lungs cleared over several days. After discharge, they recovered fully without patient antibiotics and rest. Probably gonna do 2 more patients and then end. Who is this guy? He kind of looks like... What's his name? Daniel Malloy. Like the young version from Interview with a Vampire. Okay. Let's go in here. What is it? I'm gonna call him Daniel Malloy. Okay. What do you have, Daniel? So, do you need... No, okay. 2 Zofenex... Oh, crap. 2 Zofenex Tynodoid Inflamex. So, 2 Zofenex... Tynodoid and Inflamex, right? Yep. And then you need a saline IV. Here you go, Daniel Malloy. Okay. Then you need a saline, and what else do you need? Oops. Wait. No, he needs a saline. He also needs milk, or he wants milk. He wants an ice pack. And then I will turn this down for him. Okay. You good? Is it the vampire Armand that did this to you? Okay, so vomiting, inflammation. Lord. Vomiting, inflammation, fever, yes, dehydration, and nausea. Okay, so you have acute yeah, that thing. Oh, we'll discharge you. So, admitted for bowel rest, IV fluids, in pain management. The patient's pancreas inflammation subsided after discharge. They recovered with dietary modifications. Why are you here back again, bro? Maybe that's his twin. Let's do... Oh, I am so sorry. I'm glad there's nobody with, like, severe stuff. Bro! You know what? This is the Daniel Malloy room, I guess. Okay, we are in room 6. What the? Okay. Oh my god, are you okay? Okay, 2 Zoifinex, Tylenol, and Inflamex. 2 Zoifinex. Wait, 2 Zoifinex, Inflamex, and was it a Tylenol? Yeah, it's always Tylenol. Or Tylenol. Why do I keep? Okay. Oh my god. Daniel Malloy's having a stroke. Okay. Then you need saline. Oh, this is what you do. Bro. Okay, you want a sandwich. Yeah. Sandwich, and then I will give you a saline. Bro, are you serious? You need a defibrillator. Bro, get the freaking... Are you serious? Okay, girl. Whatever. Anyway, here's your sandwich. Wait, no, ice pack. This. Why did I grab a defibrillator? Oh my god. And then... saline. Bro, let me just do this, cause your patient's gonna die. Yeah, I'm sure he's dead. Okay. Vomiting, inflammation, fever, dehydration, and nausea. No, okay. Vomiting, inflammation, fever, dehydration. Okay. You have acute pancreas. Yeah. So I will discharge you. Admit you to the hospital, and you can leave. Admitted for bowel rest, IV fluids, and pain management. The patient's pancreas inflammation subsided after discharge. They recovered with dietary modifications. I kind of want to do a severe. Because listen, if that happens with me, then I know what to do. Because I have a defibrillator. Okay. Shit. Oh my god. Okay, so saline. Okay, so beta blocker and Zofinex. Don't panic. Beta blocker and Zofinex. And then I'll give you a saline. Then, oh my gosh. You want blanket and juice. I'll give you a juice. This, juice, and then saline. Then I will give you a blanket. Why do people keep closing the doors? It's like, oh, I'm so sorry. Wait, oh my god, that's your patient. I'm gonna kill my patient. I'm so sorry. Oops. Okay, chest pain, dehydration, vomiting. Chest pain, dehydration, and vomiting. You have cardiogenic shock. So, immediately admitted to the cardiac ICU for support, medications, and medical assistance. The patient's heart function improved after weeks of recovery. They survived, with medical management. Who has severe? I want to do another severe one. No. Come over here. You guys see how there's less patience? Because I'm doing this fast. Okay. Get you in there. What do you need? So, do you need this? No. Okay. Zophanex. 2 Zophanex, Tynodoid, and Inflammant. Okay. 2 Zophanex, Tynodoid. Got this and this. And then after that, we'll give you Saline. You want water. Water's right here. And then I will turn the lights off. Hello, ma'am. Hi, Miss Parker. Here's your medicine. Then your water. Is that the right treatment? Please don't second guess. Wait. I need saline. Please don't do me like that, girl. Don't do me like that. Is this the right treatment? It should be. Yuck! Okay. Ooh, it's probably an infectious disease. Vomiting, inflammation, fever, dehydration, and nausea. So you have acute, yeah. Someone is dying! Oh my god! Stop having your freaking patients die! Admitted to the hospital? Admitted for bowel rest, IV fluids. Can I wait, hold on. Can I be the nurse for this? Can I be your nurse? Can I be the nurse? Whatever. Okay. Next patient. Moderate, low. I'll take you, I guess. Ew. Wear a mask, girl. Bro, your patient, get a freaking defibrillator. Oh my god, people make me angry. Get in, girl. Where is my patient? Yeah, he died because... Where's my patient? I swear I took her in. Okay, I guess not. Maybe she left. She was like, oh, sorry, never mind. I actually don't need to go to the doctor's. Is that her? Oh, stop coughing on me. Wear a mask. You're nasty. Yeah, that's stupid, because I swear I took that patient with me, but I guess not. Unless this is her. Whatever. Okay, Tylenol, Zophanex. Tylenol, and then Zophanex. Then she needs saline, of course. She wants the lights to be off. I will give you your milk and your water. Your milk. And then I need saline. You always need saline, to be honest. Well, all these patients. Okay. Saline. I'll be there with your water. Okay. I think after her, I'll do like one more patient and then that's it. Okay. Yeah, we're almost done. Did I diagnose you? Fever, dehydration, and was it vomiting? Fever, dehydration, vomiting. You had a heat stroke. The hospital. So, admitted for rapid cooling and IV fluids. The patient's body temperature normalized and organ function stabilized after discharge. They recovered fully with no lasting effects. Okay, let's do. Who has been coughing a lot? I mean that dude, but like, Oops, no! You know what? I'll take him in after her. That is gross, he puked on me. But disgusting. What is wrong with you, or up with you? Okay, so you need Inflamex. And then I will give you the eye antibiotics. The okay. She wants water and a blanket. Okay. And then, tearing, inflammation, eye itching. Tearing, tearing, inflammation, wait, tearing. You have conjunctivitis. Wait, conjunctivitis. Okay, I will discharge you. Admitted for severe eye infection management. The patient received antibiotic, eye drops, and monitoring after discharge. Their vision fully recovered without complications. What did I not grab? Okay, I grabbed linens. Why didn't I not grab a gown? Okay, let's hope the guy is still there so I can treat him. He is. They're freaking sneezing on me, bro. What's up with that one? I don't know. I will take you in. Oops. Okay. Whoa. What's going on? Okay. Okay. Zofinax, Tynoid, Drylex, and Infamex. Okay. Did I forget one? What is this one? Did I give you a beta blocker? I did not. I'm so sorry, sir. Okay, beta blocker. And what does he need? An ice pack and milk.